Welcome, all of you. So women's health has been a very long neglected subject of research and investment, both in medical sciences and in health tech. We're here to find out if that is finally changing. Now, I wanted to kick off this session by getting a sense from you as to what is the state of healthcare at the moment in your perspective. So what is going on, and is it better than what was there before? Helene, do you want to kickstart?
Healthcare or female health?
Female healthcare.
I think that's the first issue, is that healthcare and health is one word and then female health is another one. Mm-hmm. So basically by exclusion, it means that health is for men and female health is for women. And it's new, which is a bit shocking. And although it is growing and there's like companies that are really changing, like Elvie and but it's still like quite the beginning. So it's exciting to see that things are changing, but it's still nascent. And I think we need more awareness, more money, and to see things really changing.
Mm-hmm. Tania, what do you think?
Yeah, I would say the same as Helen, actually, maybe because we're both in the tech sector. So yeah, absolutely, we're behind in terms of political will, financing, knowledge, innovation, and so on. But I think being in tech, and when I started Elvie 8 years ago, there wasn't even the term femtech, or even as a category, women's health tech. And looking at a more optimistic side, which both of us entrepreneurs tend to do, it is. We're seeing huge improvements, right? Nearly $2 billion went into femtech last year.
Mm-hmm. Pragya.
So my interest in healthcare is from a bias perspective, about how much bias is embedded and how it undermines women's health and healthcare, and it has done through history. What kind of medical and healthcare bias gets inbuilt into the technology, and can technology provide us with our women with autonomy and the support and the choice that they need? As we know, women's rights and health is being undermined all over the world at the moment, with policy regulations as well.
Let's talk a bit about the lack of data available. So both of you on stage have spoken about the fact that women's health is very different from health in general, that a lot of healthcare is built for and around men. A lot of companies and healthcare professionals are trying to provide solutions for women right now. Have things improved in terms of the offering at the moment, do you think? I mean, you're smiling, Helene, you're like, no, or yes.
Well, I think they're changing, mm-hmm. But I think that it shouldn't be different. It should, like, health should encompass us all humans, including women, mm-hmm. which today is really a subset. Like, we're a subcategory of humans. And I think, like, when your question goes to data, like all these wearables, like I wear Oura Ring and I love it, but all these wearables, they track data sets and they read it as a man. So if my body temperature goes up, it thinks I'm sick. Mm-hmm. Not that I'm like ovulating or pregnant or in perimenopause. It's literally not able to read the data sets. And in 80% of the medical research today is still done on males. So it means that we're excluding entirely women, but not only women, because women change, they have the big life stages, and a 20-year-old woman not taking contraceptive has a total different body than a 37 postpartum or a 47 in perimenopause. So we need to also integrate these in research, and it should be compulsory for regulators to include women in research. It's not okay today with the computing powers that we have to not have all these different life stages. And when there is research on women, it's like on 30 white women in the US mm-hmm. taking contraceptive. So there's a massive gender data gap, which we're trying to solve.
Yeah, Pragya, that's something that's been your area as well. We've spoken previously about the fact that even the data that's being collated now is slightly problematic, right?
Yes, absolutely. And as Helene said, the data is very much based, there's a gender data gap, but there's also a lack of kind of intersectional data. The data is not disaggregated. So even if we consider women, it's seen as a homogeneous category, not just according to the age, the stages, life stages, but also different kinds of women as well, different ethnicity, different racial groups, whether it's trans women or not, these different categories, or when the data is not disaggregated, then we are assuming that the normative value is a white 20 plus, 30 plus woman. And I think the lack of intersectional data is a huge problem, because we know that medical or healthcare bias is very much affecting women of color. We know that Black women die 4 times more in maternity and childbirth. So I think the lack of disaggregation of data, lack of intersectional data, lack of inclusive data is really a huge problem.
At the moment, we've seen, as you were mentioning before, Tania, just an explosion of investment in the femtech sector. However, the sector has been dominated by mostly sort of reproductive services and services aimed at women and their periods and, you know, their pregnancies and how to deal with that. Do you feel that's paving the way for a larger amount of services that are aimed at a woman's entire lifetime rather than just, pardon my words, the bits, you know?
Yeah, I think it is paving the way because I think it's also probably could have been expected that within women's health technology that most effort would go around fertility and menstrual care to begin with, because one of the issues you have with women's health is you need to find problem areas which are of a high enough prevalence, disease burden, where you can also not have to have too much in terms of, you know, category creation or demand generation, i.e. too much education. Yeah, so if you look at the stats, I think there was a recent McKinsey report, and over 50% of femtech funding is, as you pointed out, for pregnancy, fertility and maternal health, and another 30% around menstrual care. So yeah, there's more to women's health than getting a period and getting pregnant, but obviously flipping that, there's also a huge amount of opportunity and white space as well.
So at the moment, we've spoken about the sort of obvious gaps that still exist. What are the biggest missed opportunities, do you think, in this sector at the moment? I'm kind of opening up to the three of you.
Yep, well, if I go first, I think, so if you think about it in terms of women's health, you can sort of look at it in terms of life stage, right? So as you said, there's been a lot of focus on the fertility side, and then if you carry on with a woman through her journey, you'd expect to see more kind of innovation around the postnatal period, and then obviously menopause, which people are beginning to talk about more now, but we haven't seen any kind of really exciting innovation that can really scale within that, I think, yet. The second kind of area is if you look more at a kind of a specific health problem that needs to be solved, so a point use case, but that would need to be, as I said, something which is prevalent enough, which isn't just around latent demand. I mean, this is the issue we found with pelvic floor health. 1 in 3 women have pelvic floor health problems, but if they don't even know that 50% of their lower back problems are caused by that, it's a huge amount of effort in order to educate, and from building a business point of view, it's very difficult to sustain and to scale. So maybe missed opportunities in areas such as polycystic ovary syndrome, so PCOS, or endometriosis, so where you've kind of got prevalence of 8 to 10%. But again, one of the issues we have is we're seeing a lot of small femtech companies focusing on these issues, but they're really struggling to get that traction, partly because there's this education gap, and partly also because the business model can be a bit flawed, sometimes maybe because D2C has become too expensive, or everyone's focusing on B2B2C, i.e. you know, health insurance reimbursements. It's very difficult to get beyond pilot phase. So I think either specific health issues and or by life stage, kind of in the short term, but really where we want to get to from a medium term point of view, is, you know, can we provide a consolidated set of offerings? So, you know, not just either a device or telehealth, but can we, you know, is there a platform play here? Are we able to offer women the most accurate and convenient solution?
Does this sort of echo with both of you as well?
Yeah, because like the fact, I believe that the fact that investment and focus is a lot on fertility is because men are involved in the equation.
Okay.
So they're like, oh, it doesn't work. And so, but the whole life, like if you look at the fertility journey of a woman, it's probably like altogether 7 years. Like I want to have a child, I struggle 1-2 years, and then the last child is like all in all 7 years. So they are the whole life of the woman that excludes that is actually really big. And when you look at periods, like probably today most women in the world do not have a period. They're in menopause, they use a contraceptive, they're amenorrhea, whatever. And so as a woman, you're changing all the time. Like you can be 35-year-old, like being pregnant, and then like 2 months ago you were taking a contraceptive. In 8 months you are postpartum, and at the same time you're in perimenopause. This is the exact same woman. It's not like a different customer. So she's probably not going to use different products. And we don't really have today this overlook, because we're looking at more like what's the issue and how can we solve it. What we are doing at World AI, we take this entry point more from a sports perspective. So we are trying to cater to women throughout their whole life, to help them perform physically first, and then like also in business. So we do have this platform approach, but there's a lot of different elements that are still lacking, and yeah, we'd love to see more players as well in the sector.
And just to echo to what you were saying about fertility, the problem being not just around women, I do also struggle with the fact that fertility is the largest segment within femtech and is seen as a women's health issue. And yet it's only 30% of infertility issues which are to do with female health, and obviously 30% to do with men, and the rest unexplained. So it's sort of almost moving backwards, isn't it, from a gender equality point of view? And
another thing is, I think we have such a lack of awareness. Like, a lot of women would, the very first time they ever hear about pelvic floor reeducation is when they get pregnant, whereas they might have like 20 years of like urine leaks and things like that, or lower back pain. And because there's all this taboo around all these topics, and when you're a woman, you're like 13-year-old, you have your periods for a second time, and you're at school and it hurts and you're bleeding, and the teacher tells you to run with the other kids, you basically hear like your pain doesn't exist and just like go with it. And that's literally like what we're doing as women. And so we have all this pelvic floor and all the other related issues, but I would love a world where very young we're educated on what it is, and it's actually a great thing, it's totally normal. And
so, I'd love that world too. And I think, talk about the plurality of issues. I mean, it's similar to what Pragya you're talking about with intersectionality, right?
Yeah, absolutely. And I echo what you're saying. And a lot of, we have to see that the technology that we're designing or creating, or the focus, or how it's being funded, or how it's being designed, it doesn't exist in isolation. It exists very much within the society. So if there are societal taboos and stigmas around women's bodies, or certain parts of processes and life processes in women's bodies, which have been created as shame or stigma around menstruation, or around menopause, around other lack of awareness, as you say, lack of sex education, the way the biology is taught is very much blinkered as well in our schools. There is very little focus on women trying to understand their own bodies in a holistic sense. So I think that is also linked to what parts of what kind of technology is funded, but also we know that there is gender equality in investment sector, and who is making these decisions is very much determining what kind of what part of healthcare is becoming a priority or not. So yes, I think for me personally, the technology is the way. I don't like the term femtech, but yes, it gets it funded and it gets it talked about. But the three things for me are trust, privacy, and autonomy. And we have to think about whether a technology that we are designing, giving women autonomy, whether they can trust it, and whether they can make these choices in a safe space with privacy. So those are my.
And I do want to touch upon that, because there's lots in the news at the moment about the attack on women's rights and on their rights to decide what to do with their own bodies. Tech companies are at the forefront of gathering a massive amount of information about women, information that could be used very easily against them in a lot of cases. How do you think tech companies should behave to improve the trust level that women should have in them, so that they can carry on using them? Because there is a problem there, right?
Yeah, I mean, there's been lots of reports that have come out about how the data is being sold, or the data is open, or that it's not been anonymized. We feel like it's anonymized, but it's been misused. And even big companies, large companies who have come into attack as well, or have come into scrutiny. I think the sector needs to be regulated more. I think it's at the moment it is unregulated, which means that even though they say it's evidence-based healthcare, or it needs to be more explicit about what is happening with the data, how is it being used, whether it's being used at the back end for further research, whether it's being given out to academic organizations or not, whether it's being used to design further aspects of the technology, what is happening with the data. Once you use this, what happens to your data? And also, how reliable are the results? How reliable is this technology? I think that is also a matter of trust, because we know that some of them are built on a template. Like, I wrote a recent article for Prospect, but I also wrote about it in my book Sway and Motherhood, about how some of these the trust, although we think it's evidence-based, they're built on a template. Like, they assume, for instance, just as an example, if they assume that all women are having their periods after 28 days, which is not the case for a lot of women. So just as a mere example. So I think it needs to be regulated And it needs to be very explicit about what kind of data is being used to train these algorithms, how the data being used, and what is the evidence that's informing the results so that women can use it with more trust.
Mm-hmm. So can I turn Pragya's comments towards you both, because you've founded companies and you run companies that gather women's data. Are you doing anything differently, or how have you set the foundations to make sure people trust you?
Yeah, and I do want to answer that. But first of all, your first part of the question, which is, are we seeing an erosion of women's health rights? Yes, we are, and that is such a big issue in terms of possibly overturning Roe versus Wade in the US.
Yes.
And it's something we all, it's beyond an issue around tech companies and trust. It's something we all need to be obviously fighting against, everybody in this room, anybody working in public health, women's rights, and so on. But yeah, so Pragya, I'm glad you made those comments, because I was beginning to think the panel were all in complete agreement on everything. So yes, Pragya, I do see your concerns, and there are some companies I can think of who do not take this trust issue seriously, and there have been, for example, as you've mentioned, within period tracking situations, obviously with an unacceptable number of unplanned pregnancies and use of contraception. But I do think in general, the femtech or women's health tech or any health tech company, they are still regulated. We have to get FDA approval to launch in the US. Any medical claims have to be substantiated. So I do agree that there are some rogue companies, but in general, it is quite a highly regulated environment, which obviously holds us to a higher standard. We always say at Elvie, we IP and we hold ourselves in terms of science to as a medical device company, but we obviously create this consumer brand. And I think there is also an approach where those who've worked in traditional medtech space are not used to this new generation of health tech companies, where if you look at Elvie, we launched our breast pump on a catwalk and a fashion show, we have a strong consumer brand. But it's all part of the strategy, because I believe, having worked in HIV prevention, having worked in sex education, that if you want to get that consumer pull, or ultimately actually better public health outcomes, you need to change those cultural taboos that you're talking about. You need to change attitudes. But we have had resistance from companies who just assume because the product looks pretty, that therefore it's not taken seriously, that it's not regulated, and that there isn't strong scientific evidence behind it. So I agree with you that there are ways that some things need to improve, but I do think in general that the for better or worse, is actually quite a highly regulated space. I don't know what your experience is. It depends, again, what the claims are, right?
Yeah. So to be able to advance research quickly, we need also flexibility. Yeah? So we do partner with researchers and universities. The process is very structured. So it's all double opt-in, so you can't have access to any of the data sets if you don't opt in, and then it's only from today onwards. Women are really aware of what the data set they share. So what's really interesting is actually women really love to share. Yep. So we were the first company to do a research of the impact of vaccine on women, and women love to share. Like in a few minutes we had 2,000 replies, because they really crave an answer to their questions. Why do you have a late period? Am I pregnant, or just the vaccine basically? And is it only the COVID vaccine, or all vaccines are always having that? We just happen to have all women at the same time. So to be able to move fast and do things that governments, researchers, universities, everyone haven't done, which is research on female bodies, we can move faster, I think, as startups. But I think one element that is important is data and AI ethics. Mm-hmm. Like if you are a company like Meta and your goal is to sell the data sets and get marketing and get the money from there, it's one question of ethics. If your goal is really, really helping women, we need to do research. But then if you have good ethics, hopefully it's good.
I want to ask one last question, because I'm aware we're running out of time here. Do you think that private companies and the amount of data that they can collect could help the sector in general to plug some of these knowledge gaps and improve the offering to women? Short answers, sorry, because I can see the red, but...
Yes.
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 Pragya?
Yes, absolutely, but it needs to be regulated, and I think it needs to be made clear to people who are using it that this is how the data is going to be used. But absolutely, I think we need data, we need more intersectional data.
Brilliant. Okay, I've got time for a couple of questions from our audience. They're good ones, the ones I've got here at the top. So we've got here one that says, how much does focusing on reproductive health just reinforce negative views that women's unmet health needs are just around reproductive problems?
Yes, absolutely. Yeah. Yeah, I think as I said, it is very much linked to how society perceives women as well. And at the moment, we're seeing this huge panic around the world around fertility rates falling, for instance, and women's fertility being monitored and patrolled, and whether you're having children or not, or whether you're choosing to have children or not. And we saw the ONS data set recently, and in the media talked about as well. We know that women, as Roe v. Wade is overturned, we know that abortion rights choices are becoming constrained. So I think, yes, it's very much linked to how women are perceived and the kind of feminine stereotypes that have existed in our society for a very long time. So I think there is also a responsibility within the sector to think about it more holistically beyond the reproductive role of a woman. Absolutely.
You all mentioned earlier how the focus on sort of reproductive tech is because it's sort of a more accessible, more sexy, more understandable option for a lot of investors who tend to be men. But here we've got a question from someone who says, dementia is the #1 cause women die from. It affects older women, which seems to be a stigma in of itself. They wonder what the panel thinks about ageism in health, which is a very difficult question to answer, and I'll give you 30 seconds to do it.
Yes, so women are changing all the time. Men have like a decrease of testosterone, but it's linear. So we need to address that. And I think we like a lot of companies now are looking into longevity, but I think they also look at the wrong place. Like women live longer. Why do we live longer? Like we don't really know that. Is it because we regenerate our blood on a monthly basis for 40 years, etc.? So I think like we can learn a lot from women and from the disease specifically that are on women. Like why is it different as well? And being able to do research on that and having answers from there, I think would be really interesting.
Brilliant.
I think just at a very basic level, public health is always around hopefully reducing inequalities and health outcomes. And yes, absolutely, there's inequalities and ageism, there's gender inequalities, racial inequalities, and so on. So they're all very important. And obviously not just within health, but in the workplace.
Pragya?
Yes, absolutely. As all of you have said, ageism is very much ingrained in our society, and especially with women, ageism affects women more because the gender and age bias when it intersects, and that very much transfers to these kind of funding as well, because it's often seen. That's why menopause has been stigmatized and not talked about a lot as well, because once women's reproductive facilities or faculties have been impaired, it seems like women are not of value to society. So I think, yeah, it very much linked to inequalities and how we use tech to address inequalities as well in our society and in workplaces, and how we empower women at different stages of their life. Absolutely.
Thank you three so much. It's been a brilliant panel. Thank you so much. Well done.